This video explains all about physical care. I am joined here by my colleague Aoife to explain what you need to know.
Engaging in physical activity is very important for your health, independence and quality of life after a spinal cord injury. It helps to improve your breathing, muscle strength, circulation, body composition and self-esteem. Physical activity helps to reduce your risk of heart disease, pain, depression and anxiety. Sports and fitness activities also provide social interaction. You do need to do a variety of exercises because they are all important in different ways. Strengthening exercises for building muscles and becoming stronger. This is important for functional activities such as your transfers, moving to and from your bed, wheelchair or car. Training can be carried out using body weight, free weights, resistance bands and weights machines. Recommended guidelines is 3 sets of 8 to 10 repetitions for each major muscle group twice a week. Aerobic exercise for improving fitness and heart health. It can also help to manage fatigue and pain over time. Exercises include, but are not limited to, wheeling your wheelchair, walking, cycling and various sports such as football, wheelchair basketball and tennis. Current guidelines recommend 20 minutes of moderate to vigorous intensity exercise twice a week. For cardiometabolic health, this is to help maintain a healthy weight, keeping your heart healthy and reducing the risk of diabetes, provided you also eat well. These are the same exercises as aerobic or fitness exercises, but must be done for 30 minutes 3 times a week. Doing more than these recommendations will give you extra fitness and strength benefits. However, if you cannot reach the amount of exercise in these guidelines, doing some activity is still better than doing nothing at all. There are many organisations that help to support people with spinal cord injury to get involved in sport and physical activity after rehabilitation. These include your local sport, inclusion and disability officers and the Irish Wheelchair Association or IWA. Your treating team can help you to find these services. Spasticity is abnormal muscle stiffness or overactivity in a group or groups of muscles. It can also be described as increased muscle tone. This overactivity in the muscle is due to a disturbance in the messages going to or from the brain through the spinal cord due to injury or disease. About 70% of people who have a spinal cord injury have some spasticity. Spasticity can cause muscle tightness or shortening, difficulty in movement and therefore in doing practical tasks, muscle tiredness, pain, fatigue, and difficulty with hygiene of the affected area. However, it is important to remember that some spasticity can be useful and can help with function, for example, your transfers. What makes spasticity worse? There are many things that can influence spasticity. A trigger is a sensation or stimulus in your body that makes your spasticity worse. Being able to identify these triggers and manage them is important. Common triggers include bladder problems, for example, a blocked catheter or the bladder not emptying properly. Bowel problems, such as constipation. Skin problems, such as pressure injuries. An ingrown toenail. Infections. Pain and discomfort anywhere in the body. Positioning, for example, a change of position or being poorly positioned in your wheelchair. And stress and anxiety. While spasticity cannot be fully reversed, it can be managed well using a mixture of different approaches, including prevention of the common triggers, positioning, again this means getting into the best possible position in your wheelchair or in bed at night time. Splinting, which is the use of a rigid or flexible device to maintain a body part in a certain position, such as keeping your knee straight. Medication, which may include the likes of baclofen, tizanidine, botulinum toxin and others. Standing. This includes a supported standing program with equipment such as the easy stand or tilt table. Stretching or lying on your stomach can be useful if advised by your therapists. Relaxation techniques are also very important. Your spasticity can get worse over time if it is not managed properly, so it is important to keep using these strategies. It is also important to note that a sudden change in spasticity could be a sign of an underlying affection. If this happens, please speak to your medical team or GP. For standing, the Multidisciplinary Association for Spinal Cord Injury Professionals, or MASCIP, recommend that standing options for all patients with a spinal cord injury should be individually assessed. This should happen as soon as it is safe to do so after your spinal cord injury. Your physiotherapist will prescribe a standing program for you, including the use of equipment, to best meet your needs. After injury, it may take many sessions before your body can tolerate being fully upright again. Different types of equipment, such as a tilt table or easy stand, may be used to support standing. The benefits of standing include managing your spasticity or increased tone, helping your bladder and bowel, improving your blood circulation, helping your breathing, and improving your well-being. Current evidence-based guidelines recommend that standing should take place 3 or more times a week for 30 to 60 minutes each time. For both complete and incomplete spinal cord injuries, the shoulders and arms play an important role in increasing independence. They are important for activities such as pushing a wheelchair, transfers, and lifting a wheelchair in and out of the car. Walking with aids such as a frame, crutches, or a stick also puts extra demands on your shoulders. Many patients with new spinal cord injuries report some level of shoulder pain. It is also common to begin to experience pain after many years of living with a spinal cord injury. Pain can often develop due to muscle imbalance, overuse, and degenerative changes, which are normal changes that happen in the body as we age. Sometimes shoulder pain is neuropathic. This means that some of the pain is coming directly from your injured nerves in your spinal cord. Protecting your arms and shoulders from the start is the best way to prevent problems developing later. One area to consider is your wheelchair. Some people with a spinal cord injury require a wheelchair for all their mobility. Your wheelchair will be individually prescribed based on a professional assessment. Lightweight wheelchairs are more suitable for full-time wheelchair users. Finding the most efficient way of propelling your wheelchair can reduce the risk of injury to your shoulders. Using longer push strokes reduces the number of pushes as well as the force needed to move your chair. Minimizing the need to travel over more difficult ground, such as steep areas, rough surfaces, is helpful. Powered mobility and powered assist options for your wheelchair can make it easier to get around, especially on uneven ground or hills, without increasing the demand on your arms. Make sure your tyres are properly inflated. Low tyre pressure increases the friction between the tyre and the ground and therefore increases the demand on your shoulders. If possible, take your wheelchair apart before lifting it into a car, or think about other options such as a rooftop hoist or installing a ramp in your car that minimises the need to lift your wheelchair at all. With regards to your transfers, if you're completing sideways transfers, you should try and complete same level transfers as much as possible. Adjust your bed height to the same height as your wheelchair if you can. The height of your car seat may also need to be considered. The use of a transfer board allows smaller lifts which reduce the amount of force needed to make a sideways movement. Your physiotherapist and occupational therapist will help you to improve your transfer technique during your rehabilitation. Leaning your body forward will reduce the amount of weight your arms will need to lift. Try to limit the number of transfers that you have to do on a daily basis. Some people with a spinal cord injury recover the ability to walk. If you require an aid to walk, you will increase the strain on your shoulders and your wrist and hands. Strategies such as pacing, frequent rest breaks, and good posture awareness can help to prevent the long-term effects of strain from overuse. Other ways of protecting your arms if you have a painful shoulder include using your less used, non-painful arm for basic tasks such as feeding, opening doors, or leading with your uninjured arm during transfers. Modifying your environment, for example, moving your body close to something or using assistive devices such as a grabber so you won't need to move your shoulder as much. Asking for help with tasks that are causing you pain. It is important to remember that twinges and minor aches in your arms and shoulders can occur and are normal after a spinal cord injury. However, if these do not go away after a few days and you are concerned, contact your GP, community physiotherapist, or the NRH liaison nurse. Neuropathic or nerve pain is common and is one of the most distressing consequences after a spinal cord injury. Neuropathic pain can start soon after the onset of an injury or develop later. It can affect part of a limb, a whole limb, or a much larger area of the body. People describe nerve pain as a burning sensation, like a toothache, like an electric shock, or more of an uncomfortable sensation than a pain. For some people, the pain comes and goes, and for others it is constant. Some people find that certain things trigger their pain, such as cold weather, a urinary tract infection, or constipation. There are many strategies that may help you to manage your neuropathic pain. This includes regular exercise, which when used with other strategies, helps to maintain flexibility and movement. Exercise can directly help relieve inflammation and stiffness that can cause pain. Aerobic exercise like cycling, walking, and some sports also encourages the body to produce its own pain-relieving chemicals. Try to balance aerobic exercise with strengthening and stretching. You may get a mild flare-up of pain when first starting to exercise. This is normal and not a sign that you are doing further damage. Other strategies you can consider to help to manage neuropathic pain. Medications can be used to help with neuropathic pain. However, they are not always effective for neuropathic pain and some may have side effects. Some of the most commonly used medications are gabapentin, pregabalin, and amitriptyline. Transcutaneous electrical stimulation, or TENS, is a form of electrical stimulation which can help to trigger the body's own pain relief systems. It is applied using electrode stickers which are placed on the skin. Psychological strategies, including distraction, goal setting, relaxation, and challenging negative thinking, can also be very helpful. One of the most effective treatments for pain is a pain management program, which is made up of many different elements. For example, a physical program including stretching and aerobic exercise, cognitive behavioural therapy, education about pain, and relaxation strategies. Everyone's pain is different, and therefore what people find helpful to manage their pain will also differ. People living with neuropathic pain and spinal cord injury for a long time report that distraction is one of the best treatments for their pain. In other words, engaging as much as possible in a range of normal life activities, including family life, work, and recreation. Fatigue can be defined as extreme tiredness after mental or physical exertion, or as a result of an injury or illness such as a spinal cord injury. It can feel like a lack of energy, weakness, or being too tired to take part in activities. It is different from drowsiness, which is linked with the need to sleep. Factors commonly associated with fatigue include, but are not limited to pain, poor quality sleep, spasticity, poor diet, poor memory, and reduced concentration. Fatigue can sometimes hide low mood or depression. Be aware of any stresses or emotional issues, as well as physical ones, that may be causing you to feel fatigue. Strategies that may help you manage fatigue include pacing. Pacing means doing things at a steady or planned rate rather than in bursts. It allows you to save energy and prioritize tasks that are important to you. Exercise. While exercise can contribute to fatigue, it also helps to build up your ability to deal with it. Try to eat well, eating a balanced diet, and try not to skip meals. Manage your workload and stress levels. Keeping your workload at a steady level from day to day helps to reduce stress. Set small goals and prioritize tasks. Plan rest times. Modify daily activities to build in rest periods. Give your brain a rest by taking time out from concentrating. This could mean sitting quietly, listening to music, or practicing relaxation or mindfulness activities. Avoid napping. Napping can disrupt your sleeping routine. If you need a nap, limit it to 20 to 30 minutes and avoid napping after 3 p.m. Be aware of what you can and cannot do and ask for help when needed. It is important to engage in meaningful, enjoyable, and rewarding activities.